Welcome to the Oklahoma Autism Center. The purpose of this video is to walk you through what a consultation is, what a consultation is not, and the steps for receiving a consultation. For over 20 years, the Mesa project, formerly known as Project Peak, has provided consultation and professional development to educators and professionals who work with children with autism spectrum disorders. Our team brings together the combined experience of certified special ed teachers, general ed teachers, speech-language pathologists, occupational therapists, board-certified behavior analysts, and psychologists. Our goal is to build capacity in the public school system to support children with autism. We do this by teaching evidence-based practices in our statewide trainings and workshops and through consultation with individual school teams. When we come to your school as a consultant, we are just another set of eyes on the current situation in your classroom. We meet teams where they are and understand that all teams are at different levels with the amount of resources and training they have had specific to students with autism. During the consultation, we might model for you how to implement these specific strategies with your students or within your classroom. We will coach your school team as they learn to implement the strategies during the consultation. We will also provide you with resources and strategies specifically designed for students with autism in the school setting. Consultation services are provided at no cost to the district through a service agreement with the Oklahoma State Department of Education. A consultation is not a formal evaluation or assessment on your student. Although we are not officially part of your IA team, your team might choose to use some of the strategies and recommendations in the student's IEP. A consultation is not a process for evaluating you as a teacher and/or evaluating your classroom. What concerns are often addressed during a consultation? Each concern that we receive is different and individual to each student and our classroom. Some examples of concerns include challenging behavior, helping teachers know what to teach students with autism, ideas for classroom management, tips for functional communication, to name a few. The first thing you need to do if you would like to request a consultation is to contact Marissa Singletary at the Mesa Project. You can contact her at 405-842-9995 or email her at marissa-singletary@ouhsc.edu. If the concern so Marissa then will contact you. You guys will talk on the phone, and if the concern that you're indicating would be appropriately addressed through a consultation, Marissa will send you the paperwork needed to schedule the consultation. Once we receive the paperwork back from you, you will then get a phone call from the Mesa Project to address scheduling needs, desired outcomes, team meeting needs. Marissa will follow up by sending you an email confirming the date, time of consultation, and the specific name of the consultants coming to see you at your school. Prior to the consultation, once a consultation has been scheduled, before we come out, you will get a phone call from the specific consultants who will be coming to your school. The consultants will introduce themselves and verify location, schedule, and need for consultation. The consultant might ask you a few specific questions regarding the consultation, and the consultant will also let you know if there's any materials that need to be present prior to the consultation. On the day of the consultation, each consultation looks a little different based on the need of the school. Typically, the consultation starts with a short meeting prior to the observation with the teachers that spend the most time with the student, just to see if there's any more updated new information since we talked with you originally. The consultants will then typically observe the student during their normal daily activities. The consultants might model and coach the team through some strategies. The consult typically ends with a brief meeting with the team. The school team is also welcome to invite parents if they would like to. The consultation time varies anywhere from a half a day, a couple hours to a half a day, just depending on the need of the school. After the consultation, you will typically receive a report within 2 weeks. The report has a summary of the concerns, the observations on the day of the consultation, and recommendations. You will also receive a phone call from the consultant in about 2 weeks to see how things are going, to see if you received the report and if you have any questions about the report. We will also send you a follow-up survey to get your feedback on the consultation. There are other options for follow-up after the initial consultation. We can do another on-site consultation, so if you feel like you need some more support directly, we can come back out again. We can also answer questions over email, over phone call. We have a new exciting opportunity where we're going to start hosting monthly virtual collaboration with specific topics of interest. If you would like more information on this, you can email Marissa Singletary at marissa-singletary@ouhsc.edu, and she will send you information on how to be a part of that new opportunity. Here are some frequently asked questions about consultation services. What if I have to cancel or my student is not at school? If your student cancels or you need to cancel the consultation, please contact the consultant immediately. The consultant probably gave you her cell phone number or email address, so you can contact them directly. If you're requesting, do I need to let parents know about the consultation? If you're requesting a consultant for a specific student, you need to have the family sign a consent. The consent stays at your school and is specific for your school district. Does this become part of the student's IEP? This is not an official piece of the IEP. However, the team might choose to incorporate some of the recommendations from the consultation in the IEP. What should I have prepared ahead of time? This really depends on the concern for the consultation. This would be a good thing to discuss with the specific consultant coming to your site prior to the consultation, so you can discuss if there's any materials needed. How long is the consultation? The length of the consultation varies depending on each unique situation. Typically, a consult lasts a half day, sometimes more, sometimes less. What if the student does not demonstrate any of the behaviors of concern on the day of the consultation? Often the behaviors are not observed due to putting strategies in place during the consultation. So some of the behaviors that you might have originally been concerned with, once we model and do some different strategies, a lot of times those behaviors decrease. However, we do know that sometimes when somebody's there, students act differently. So we'll walk you through that as consultants, walk you through what to do when those behaviors do occur, and how to use the strategies that we're going to discuss with you when those challenging behaviors happen. Thank you, and we look forward to meeting you and having the opportunity to come to your school to do a consultation.